Hello dear students, myself Bhavani Pentela, working as an assistant professor in Noida Institute of Engineering and Technology, Greater Noida. Today I am here to discuss about the subject code BP404T second unit, which include pharmacodynamics. In this today lecture we are going to discuss about the pharmacodynamics. It means mechanism of action and principles of drug. Okay, so before going to the pharmacodynamic, let me see what is a drug or what is the drug and how it acts on your body. So, if I am talking about in a pharmacology, what it mean? What is a pharmacology? Pharmacology is a study of a drug. If you are studying about in a drug, if it is in a therapeutic effects, adverse effects or whatever may be, then you can term it as a pharmacology. The study of a drug you can call it as a pharmacology. It has been broadly classified into two types. One is pharmacokinetics and second one is pharmacodynamics. In first unit you have discussed about the pharmacokinetics, you have well known about what is a pharmacokinetics. So, what the body does the drug is represents the pharmacokinetics. In that you can study about the absorption, distribution, metabolism and excretion of a drug. Okay, now in this today's session we are going to discuss about the pharmacodynamics. Okay, so let me say what is a pharmacodynamics. So, pharmacodynamics it means what the drug does the body. After taking of a drug, what the drug is going to change the action inside the body. So, it includes the mechanism of action, receptor binding, biochemical and physiological actions of a drug. So, here we will see the example like adrenaline. So, what is an adrenaline? Adrenaline is a sympathomimetic drug. It is a neurotransmitter. Which type of neurotransmitter it is? It is GPCR receptor. Which type of receptor it is? GPCR. Adrenaline will act according to the GPCR receptor. It consists of two receptors mainly. One is called alpha and second one is called beta. Okay. When the adrenaline releases from the presynaptic neuron, it have to show its action by binding to the postsynaptic neuron. After that, it will show its action respectively what it want to go. Okay. Now, the adrenaline, when this adrenaline interacts with the receptor, which type of receptor it is? Adrenoreceptor. When this adrenaline releases from the presynaptic neuron, it come and bind to the postsynaptic neuron, which consists of an adrenoreceptors. How many types of receptors are there for adrenaline? We are having two types of receptors. One is alpha receptor and second one is beta receptor. Both are GPCR receptor, which means G protein coupled receptor. So, once the adrenaline bind to the adrenoreceptor, then what is going to happen? It will stimulate the adenyl cyclase because it will act through the GPCR. So, it will stimulate the adenyl cyclase activity. By stimulating the adenyl cyclase activity, what is going to happen here? It will increases the cyclic AMP levels. So, if you see when the adrenaline bind to these adrenoreceptors, what is going to happen? It will stimulate the adenyl cyclase. Once the stimulation of adenyl cyclase in turn result in increase in cyclic AMP levels. Once the increase in cyclic AMP levels reach inside the cell, what is going to happen? You can see the cardiac stimulation, hepatic glycogenolysis and hyperglycemia. So, these are the effects which you can see with the adrenaline when it go and bind to the effect. So, here I had said you what is a dynamic, what the drug does the body. After entering the drug inside the body, what the biological and physiological action is coming by the drug. So, here once we had administered the drug adrenaline and what the changes has been done inside the body? Cardiac stimulation, hepatic glycogenolysis and hyperglycemia. So, this is the effect produced by the adrenaline. So, now we will see about the principles of drug action. So, we know that the drug is used to treat any disorder or to diagnose or to prevent the disease. It do not alter the ongoing action, it will alter the ongoing action, it do not alter any function of any system. After taking of a drug, it do not alter any function, it do not changes any function inside the body, but it will alter the pace of ongoing action, what we exactly need here by the drug. Okay. So, here in the principles of drug action, we will discuss about 5 types of principle of drug action, like mainly stimulation, second one is depression, third one is dual action, fourth one is irritation, fifth one is replacement, sixth one is antimicrobial effect and last one is modification of immunostatus. So, these are all the principles of drug action. So, we will discuss one by one here. First one is stimulation. So, what the stimulation? What is mean by stimulation? Once the drug enter into the body, it will increases the activity of any specialized cells. If the drug increases the activity of any specialized cell, then you can term as any stimulation. So, here we can give the best examples like adrenaline. Okay? Adrenaline, when you had taken the adrenaline, it will stimulate the heart. So, it will stimulate the heart. So, what is the action produced by the adrenaline? It will stimulate the heart by increasing the cyclic AMP levels, cardiac stimulation. And second example was pilocarpine. Which type of drug it is? Pilocarpine is an cholinergic drug. Okay, when you had taken the pilocarpine, it is used to stimulate the salivary glands. Once you taken the pilocarpine, what the action is produced by the pilocarpine will go and bind to its particular receptor and it will shows the salivary gland stimulation. And the next drug was morphine. Which type of drug it is? It is an opioid drug. It is a narcotic drug. It having its own receptors, opioid receptors. When the morphine go and bind to its own opioid receptors, then what is the action is going to stimulate? Here the vagus and CTZ, chemoreceptor trigger zone responses will get increased, it will get stimulated by the drug morphine. And the last drug, picrotoxin. So, picrotoxin, which type of drug it is? It is usually used as a central nervous system stimulant drug. So, once you are taken this picrotoxin, it will stimulate the CNS. But the one point you have to remember here, every drug stimulate at its therapeutic dose. Here I had said the examples adrenaline, so pilocarpine or whatever it may be, morphine or picrotoxin. It will stimulate in a therapeutic dose on a respective centers, right? And if the dose has been increased in a little bit manner, then what is going to happen? The same drugs will cause us the depression of a system. So, here increase in dose, the point you have to remember, once the dose has been increased, instead of stimulation, the system will get depression. Okay. So, here I had given the example high dose of picrotoxin. So, picrotoxin, just before we had said here picrotoxin what doing here? Picrotoxin will stimulate the CNS. So, what is the stimulatory action of picrotoxin? It will stimulate the CNS, right. So, once you had given this picrotoxin in a high dose, you had increased the dose. So, the picrotoxin, instead of stimulation the CNS, it will depresses the respiratory system, it will depresses the CNS system. So, increase in a dose which will causes the depression. In the same way, if I had given the morphine, actually morphine is a substance, so morphine is a drug which is going to stimulate the vagus and CTZ. But if the dose has been increased, what is going to happen here? It will depresses the respiratory system and cough center. If you had increases the dose of a morphine, it going to depress the cough center and respiratory center. And next one is depression. So, what is a depression? Depression represents decreased in activity. You decrease the activity in a specialized cells, you can call as a depression. So, there are some drugs which can causes the depression of a cell, or there are some drugs which can decreases the activity of a cell. So, here quinidine. So, which type of drug it is? It is an antiarrhythmic drug, right. So, quinidine is a drug, when you had administered this drug, it will causes the depression of a myocardium. Once you had administered the quinidine, what it is going to do? It depresses the myocardium, it will depresses the heart. But nowadays, the quinidine drug has not administered in US. This is the drug has been not used nowadays, no longer is used in US, and it has been stopped on 2019, right. And next one, barbiturates. So, barbiturate, it is a category of hypnotic and sedative drug. Usually it is used to depress the central nervous system, even it can depresses the respiratory system as well. So, what is the action of barbiturate here? Depression. It is used to decrease the activity, it is used to decrease the activity of a cell. And next one, benzodiazepine. So, benzodiazepine is also a sedative hypnotic drug which is used to depress the respiratory center or central nervous system. Okay, next we will see the dual action. So, the name it represent dual action, it having the twice action, it has in the dual action. What the dual action? Here drug is the same, okay, here the drug is the same and the action it is seen is dual. So, one type of system it will causes the stimulation and in other side of the system it will call the depression. So, this is called as a dual action. So, if you see here an example, acetylcholine. What is an acetylcholine? It is a neurotransmitter, it is a cholinergic drug. When you had administered the acetylcholine, it will stimulate the intestinal smooth muscle. So, what is the action produced by the acetylcholine? It will causes the stimulation at smooth muscle, it will causes the stimulation at intestinal smooth muscle. The same acetylcholine drug will depresses the SCA node of heart or SCA node in the heart. So, once you had administered the acetylcholine, it will depresses the heart, SCA node in the heart. And the second example was morphine. Morphine will stimulate the vomiting center, it will stimulate the CTZ, and the same drug will depresses the cough center and respiratory center. So, this is the example which falls under dual action. So, these are the drugs which having the stimulation action at one side and having the depression action on another side, right. So, the example falls here was acetylcholine and morphine. Acetylcholine is a drug which will stimulate the smooth muscle of intestine and which will depresses the SCA node in the heart. And the second example was morphine, a narcotic drug which will stimulate the CTZ, it will stimulate the chemoreceptor trigger zone, it will stimulate the vomiting center, but it will depresses the respiratory center and cough center. And what is the action? Next one is irritation. This is another principle of drug action was irritation. So, here some drugs like purgatives, bitters, whenever you had administered the drugs, it will by the irritation action, it can produce the desired effects. So, actually this irritation action was non-desired action. This is the irritation action, it is a non-specific action which you can see in almost all tissues. So, what are the cellular changes will be produced by these drugs? First one is astringent effect and second one is dehydration and the third one is cytotoxic action. These are the actions which are produced, these are the cellular changes which have been produced by the irritant drugs. And next one replacement. So, replacement we have to replace. So, here we will use the natural metabolites or hormones on their deficiency state. If the particular person having the deficiency in particular condition, we will replace with the drugs. For example, if you see the drug like levodopa, so where we can use where you can replace the levodopa, you can replace the levodopa in the Parkinsonism disorder. So, insulin is replaced in the diabetes insipidus. So, if any having the vitamin deficiency, so you can replace you can give the drugs, you can give the drug like vitamin tablets or capsules, okay, and you can give the iron in anemia condition or in osteoporosis condition, you can administer or you can give the calcium. So, these are the drugs which you can administer as a replacement therapy where the drug has been demanded for a particular condition. And what is the next one? Antimicrobial effect. So, this is the next principle of drug action was antimicrobial effect. Here the drugs are used to prevent or arrest the addiction of an infections. So, here the drugs in replacement antimicrobial effects, here the drugs are using to treat the antimicrobial infections. Here is the examples false was antibiotics. So, you are having a lot of antibiotics like penicillin, chloroquine, judovidan, cyclophosphamide, tetracyclines, all these other drugs will falls under antimicrobial action. And what is the last one? Modification of immunostatus. Here the drugs whatever you are using will modify the immune system. So, how it will modify the immune system? For example, vaccines, sera. So, if any other drugs like what is the drugs here? Levomethasone and corticosteroids. So, these are the drugs when you had given it will alter the system, either it can stimulate or either it can depress the immune system. These are the alteration of an immune system response, either it can stimulate or either it can depress. Okay, so, these are the principles of drug action where I had mentioned all in a single chart here: stimulation, depression, replacement, irritation and cytotoxic, and here we will see which site the drug will go and acts. For example, if you see the stimulation, so what drug is going to stimulate here? Adrenaline. Adrenaline will stimulate, and where the site it will stimulate the heart. And what is the next example for depression? The depression, if you take, you can take the morphine, you can take the barbiturate, alcohol. The site was CNS. So, where it is going to show its depression action? On CNS. Okay, next one replacement. So, you can replace the drugs or hormones. So, the replacement site was endocrine system. Next one irritations. So, irritation drugs. What are the irritation drugs? Bitterants, purgatives, all these are the drugs which falls under irritation action. So, where is the site? The irritation drugs will show GIT. And last one is the cytotoxic action. So, if I am talking about the cytotoxic action, antimicrobial and anti-cancer drugs. So, what is the site of these drugs? Parasitic cells. So, these are the particular principles of drug action of for a drug at the site. Okay. So, here we had completed about the principles of drug action which represents the stimulation, depression, dual action, antimicrobial action, depression and finally, alteration in immune system. And now, we will discuss about a mechanism of action, how the drug exactly act when it enter into the body. So, before discussing about this mechanism of action, I have to say the two terminologies, what is meant by drug action and what is meant by drug effect. So, if you hear these two terminologies, you can say that both are the same, yes. Yes, almost is that both are same, the drug action and drug effect, both sometimes you can termed as any synonyms. So, what is the minor difference between the drug action and drug effect? If the drug entered into the body and if it going to interact with the receptor and it form the complexation, then it is called as any drug action, and when it results the physiological or any biochemical consequence, then it is called as any drug effect. So, this is the difference between the drug action and drug effect. So, the drug action and drug effect has been determined by some few parameters, like what are the few parameters: absorption of any drug, how the drug has been absorbed, like the oral route or in a parenteral route. Even the first pass metabolism also can define the drug action and drug effect. Biotransformation, next excretion, next tissue affinity, and the condition of a body. All these conditions can say how the drug shows effect and what is the site of action of a particular site. So, the drug action and drug effect can be determined by these parameters, like the site of absorption, second one is first pass metabolism, biotransformation of any drug, excretion of any drug, and how much affinity the drug has been bind to its tissue, and finally the condition of any body also represents the drug action and drug effect. And now we will see what is the exact mechanism of any drug. So, once the drug enter into the body, it can show its action by two ways. One is non-receptor mediated drug action and second one is receptor mediated drug action. So, what are the examples falls under non-receptor mediated action? So, here there is no role in the receptor, non-receptor through it will show its action. So, in the non-receptor drug action, examples are physical action, chemical action, action through enzymes, action through ion channels and transporters. All these 5 categories falls under non-receptor mediated drug action. And what about receptor mediated? The receptor mediated, here the receptor will play a major role when the drug enter into the body. It will bind to its receptor and it will shows the physiological actions, or it will produces the desired effects through the particular system, right. And if we are talking about the, we will see one by one here. First we will discuss about any non-receptor mediated drug action. Okay. So, the non-receptor mediated drug action, first one is physical action. So, first we will discuss about the physical action. So, there are lot of conditions, there are lot of categories falls under physical action. You can say, if the color also falls under the physical action, physical mass, smell, taste, right, all these will falls under the physical action. So, if I am talking about the color, so tincture of cardamom, if I take the color also represents the physical action. Next, the physical marks, for example, if I had taken the agar drug as an oral therapy, you had administered by an oral route, which drug you are going to administer? Agar. Once it entered by the oral route, it will swells, it will absorb the water. After getting absorbed with the water, it will get swells and causes the laxative effect. It will shows its effects by the physical action. And second and third one is smell. So, you can see the smell of an drug. For example, if there are some drugs having the unpleasant smell, to get the to compensate the unpleasant smell, you will add some the pleasant smell ingredients like peppermint oil. So, this will acts its action to the physical nature. And last one is not last one, it is a taste. So, here the taste also represents the action. For example, if you see the bitters, so bitters are the drugs which will causes the appetite, it will increases the appetite by acting on ZIT. So, the physical action, the taste is also in a physical action. And next to the physical action was osmolarity. So, osmolarity is also another physical action which you can see. For example, here you can, the best drug falls under osmolarity was diuretics. Okay. Next one, adsorbent. By the adsorbent property, the drugs will shows its action into the physical manner, like a kaolin, activated charcoal, all these are the drugs which will causes the adsorption. And next one is smoothing demulcent. Smoothing demulcent is also the drugs which will causes the physical action, which will causes, it will shows its action by a physical manner. And last one is radioactivity substances. The radioactivity like iodine 131, it is used in the treatment of an hyperthyroidism. So, it will shows its action through the physical action. It will shows its action by the physical properties. So, all these are categories which falls under physical properties, this odor, osmolarity and adsorbent, smoothing agent, smell, right, and physical mass, all this falls under physical nature. And next one, chemical action. Chemical action, here the drugs will participate in the chemical reaction to produce the action. For example, the best drug was antacids. The antacids are the drugs which are used to which are used in a particular condition like peptic ulcer, what the chemical reaction is going to see here, when you had administered the antacids, these antacids will decrease or it will neutralize the HCl inside the body. So, once the HCl has been neutralized, then what and how it going to treat? It going to treat the peptic ulcer. The peptic ulcer is due to the production of HCl, due to the more amount of production of HCl. Once the antacid has been administered, it will neutralize the HCl. So, here the antacid will participate in a chemical reaction and it will shows its action. And next example was potassium permanganate. So, potassium permanganate is a drug, it has an oxidizing property. So, the chemical action is here oxidizing, right. Next one, chelating agents. So, chelating agents, the best example was EDTA. EDTA as a chelation of heavy metals, it will chelate the heavy metals. All these are the examples falls under chemical action. And here one point I have to say you, the lot of the drugs in the market will shows its action by the physical, chemical, enzyme, ion channel, transporters, or either by receptors. Only few of the drugs, only handful of the drugs, it will shows its action by physical and chemical action, and then lot of the drugs which will shows its action by the enzymes, receptors, ion channels. Okay. And if you see here, the next category was enzymes. So, it is a very important category where the drug going and bind to these enzymes and it will shows its physiological actions. So, it is a very important target site for the drugs, because almost all biological reactions has been carried out under the catalytic influence of the enzymes. You know that enzymes are very important for a drug target site, right. Once, because it is if I am talking about enzymes, it is almost all biological reactions has been carried out under the catalytic influence of enzymes. So, here we can say that some of the drugs can stimulate the enzymes and some of the drugs can depress the enzyme. If any drug is going to stimulate the enzyme, which you can call as an enzyme inducers, and when the drug is going to depress the enzyme or when it is going to block the enzyme action, then you can call as an enzyme blockers or enzyme antagonist drugs. So, here we will discuss about the two categories, one is enzyme inducers and second one is enzyme inhibitors. Okay. So, here these enzymes has been classified according to its name, according to its action. Enzymes has been classified into the inhibition action and stimulation action. So, if the enzyme has been stimulated, then you can call as an enzyme inducers. If the enzyme has been inhibited, then you can call as an enzyme inhibitors. And these enzyme inhibitors has been inhibited by the two ways, specific inhibition and non-specific inhibition. If I am talking about specific inhibition, it is further divided into two types, competitive specific inhibition and non-competitive specific inhibition. Okay, next we will discuss about the enzyme stimulation. So, here I had said you the drugs acting on an enzyme either can stimulate the enzyme or either can depresses the enzyme. First we discuss about the enzyme stimulation. So, here the drugs, there are several drugs which will increase or which will stimulate or which will induces the enzyme. So, here for example, adrenaline. Adrenaline is a drug which will stimulate the adenyl cyclase. What is an adenyl cyclase? Adenyl cyclase is an enzyme. So, once you had administered the drug adrenaline, it will stimulate the adenyl cyclase. So, the stimulation action of adrenaline was stimulation. Here the adrenaline will stimulate the enzyme. Which enzyme? Adenyl cyclase. And next one is enzyme inhibition. So, here there are some of the drugs when after administered, it will act on the enzyme and will causes the inhibition of an enzyme. So, here we will see the examples which falls under enzyme inhibition. For example, physostigmine. So, physostigmine, which type of drug it is? It is an cholinesterase inhibitor. So, the physostigmine is a drug which is going to block the cholinesterase enzyme. So, this is the action. So, it is showing the inhibitory action, the physostigmine showing the inhibitory action of an enzyme. Which enzyme it is? Cholinesterase enzyme. And what is the second drug? Acetazolamide. Acetazolamide, yeah, it is a diuretic drug, right, and it is, especially if I am talking about acetazolamide, it is a carbonic anhydrase drug. So, when you had administered the acetazolamide, it will inhibit the enzyme. Which enzyme it is? Carbonic anhydrase enzyme. The acetazolamide will inhibit the carbonic anhydrase enzyme. And if I am talking about captopril, so the next example was captopril, anaropil, all these are the drugs which are going to show its action by the inhibitory. And next, these are the few examples where you can see here competitive inhibitors and enzymes. What are the drugs what are the competitive drugs and what are the specific enzymes here, right. And second one is non-competitive inhibitors. There are some drugs which shows the non-competitive. So, one point here I have to mention here, the competitive drugs are the drugs which will act on the catalytic side of any enzyme. Non-competitive drugs are the drugs which will act on other than catalytic side. It will act on any other site of an enzyme and going to block the enzyme action. These are the non-competitive inhibitors on a particular enzyme. And these are the drugs which will act through the ion channels. Ion channels, these are the drugs, for example, quinidine, nifedine, okay, sulfonyl ureas, amlodipine, phenytoin, ethosuximide, local anesthetics. All these are the drugs which will block or which will open the channel by the ions. It is the ion channel openers and blockers. And last one was the transporters. Here the drug will shows its action by the transporters. Here the transporters are the drugs which will carry the substrate and it will shows its action. And if you are giving the blockers, if you had administered the blockers, it will block the transport of a substrate. So, here, thank you so much.